Are you suffering from brain fog, unexplained weight loss or gain, having hair loss, and achy joints, and overall just feel crappy? Well, hang on, because I'm going to tell you what are the proper thyroid tests for you to get so that you can find out what is going on. My name is Michelle Antonelli. I am a certified health coach. I help people suffering from thyroid disease get better, reduce their symptoms, heal their thyroid, and take your life back. So, let's talk about testing. It's very important to get proper testing. Without it, you really don't know where you're at in your healing journey, or even if you have a thyroid disease, or if you have an autoimmune component to your thyroid disease. The other thing about getting proper testing is when you go to your physician, you may get some resistance to some of these tests. So you have to learn how to become your own health advocate. You need to talk to your doctor, tell him you want these tests, and if he gives you some resistance to it, just explain to him that you want to know where you're at. So the other thing about thyroid testing is you want to go in the morning. And if you are taking any medication, you don't want to take your medication that morning so that you can get properly tested. So the first thing is TSH, otherwise known as thyroid stimulating hormone. This is the gold standard. Many physicians will stop at TSH and they'll tell you, you're fine, you're in range, and yet you still feel really crappy. And this is exactly what happened to me. So there is what's called a reference range. And the reference range is a standard deviation of the local population. This is why there is different reference ranges in different parts of the country. The other range is the optimal range. And this is where you want to be. This is where you're going to feel the best. And this is where a healthy adult without any sorts of metabolism issues will be. After TSH, you want to get free T4, free T3, and reverse T3. These are the actual thyroid hormones that are circulating in your blood. And then you also want to get your thyroid antibodies. This is one especially a lot of doctors are resistant on. You want to know where your thyroid antibodies are, and just for your information, a lot of times these thyroid antibodies will already be present up to 10 to 15 years before you're even diagnosed or even have any kind of symptoms. It's also the reason why when you start your healing journey and you start doing some things to heal your thyroid, you want to know this number, so you want to know if what you're doing is helping. So definitely you want to get the antibodies. It's also going to give you the diagnosis of whether you have hyperthyroid Graves' disease or hypothyroidism, Hashimoto's. The next thing is you want to check for any nutritional deficiencies. So this would be vitamins B12, vitamin D, ferritin, and selenium. These are all necessary for proper thyroid function. Then you want to get other hormones tested. Cortisol. This is what's produced in your adrenals. And many people, this is what happens, that they're so tired. So that if their cortisol is off, and this is a result many times of adrenal fatigue, and when the fight or flight gets activated too often. This happens because of stress. And so you really want to work on getting your stress down. It's very, very important. And I know for me and my healing journey, definitely I had issues with my adrenal glands. I was under a lot of stress, raising kids and running a business. And so that's super important. The other hormones, sex hormones, are estrogen, progesterone, and testosterone. So to recap, you want to get TSH, free T4, free T3, reverse T3, and your antibodies. And you want to get vitamins, B12, D, selenium, and ferritin. Other hormones, cortisol, estrogen, progesterone, and testosterone. And the other thing about testing is you want to have your hormones tested a minimum of every 6 months. Ideally 3 months. That's what, when I was getting tested, when I had active Graves' disease, I was getting tested every 3 months. And also, if they do change your medication, after you've been taking your medication for about 6 weeks, you want to have your thyroid hormones tested after that as well. So I hope this helps. I'm glad, Selena, that you showed up. This is my first live, so I appreciate you being here. If you have any other questions, or you've liked my first live here in Thyroid Thrivers and Survivors, give me some fire or give me some love. And if you want to know anything more about testing, put testing below. And I wish you much health. Make sure you, before you go to your appointment, you take this with you and you know which tests that you need. Be sure to be your own health advocate and just tell your doctor you want to work on getting healthy, that these are important tests for you, and I wish you all the health and happiness. Bye now.